Okay, folks, hey, here we are, back again. Hey, Dr. Ian here, Dr. Autoimmune. We're going to be talking about anemia today. This is one of the more common subjects that come up. So, got there. So again, if you guys have dealt with chronic anemia or you suspect, what's up, Debbie? You suspect that you might have anemia, we're going to talk about it. There's a lot of topics when it kind of relates to this subject, but it's so common. And so the reason why we're going to take some time in going through it is that there's a very good chance that some of you right now, whoever's seeing this live, they're dealing with anemia. Your doctor's been told that you need an iron supplement, right? You've been told that you're borderline. You have, again, you've got like the ridging going on in your nails, or you may have a onycholysis. You actually have like the spooning going on with your nail. You may feel cold. You may feel fatigued, right? They may have said, hey, it's not a thyroid problem, but you are, again, borderline, or you've got low levels of iron. So we're going to talk about that and more from the relationship of, hey, again, how do we diagnose it? What are the most common mechanisms and causes? What are the things that I do from a functional medicine approach, which, again, sometimes is more of a primary care approach, but I kind of have to do that at the same time as I'm doing functional medicine, meaning that sometimes I do need to refer out to other people. People do get gastrointestinal bleeds. People do need to get upper and lower endoscopies. But again, the limitations of endoscopy, right, upper and lower, is that they're looking at macroscopic issues. So if you don't have a lesion, again, let me ask you guys this question. Who here has done a upper and a lower scope and it was totally normal? Has anyone actually been told they're anemic, but their scopes were normal? That's the first question. Okay, Libby, yep, that's a me. Me and me. Debbie, you, right? Luch, yeah, Luce, exactly, me. So that's going to be pretty common that people will go through a scoping process and procedure, and their doctor's like, well, you still have anemia, you still got to take your iron, but we don't know why you have iron deficiency anemia. Remember, there is anemia of both macrocytic, right? So large white red blood cells, that's a macrocytic anemia, and then there's microcytic anemia. So a true technical definition of iron deficiency anemia is something called a microcytic hypochromic. So that's actually where you get smaller red blood cell size. There's actually less levels of hemoglobin, okay? And the red blood cell is, again, as a result, it's changing its dimension and size because of a lack of iron issue. Versus like a classic B12 anemia, you're getting a larger red blood cell, a larger mean cell volume, right? Your MCV is actually increasing in size because it's a compensation for that lack of nutrient and the fact that you actually can't replicate those red blood cells. So again, right? Yeah, so Libby right there says, hey, my NP in oncology said mine was due to SIBO. So again, just so you guys understand, the number one, right? So again, the symptoms wise, like we should cover that. Fatigue, gonna be super common here when you see low levels of anemia. Again, what does it mean to be anemic? Well, again, if you look at lab values, a lot of times it's less than like a 12 if you're looking at your ferritin, okay? So that's when they're going to actually say, okay, well, now you have anemia. It's not based on your hemoglobin. It's not based on your red blood cells. It's based on your ferritin number. Now, here's the thing. If you have a ferritin, right, less than a 25, I usually start to find symptoms associated with that. The brain fog, depression, fatigue, motivation issues, like just can't get yourself going, motivated. That's going to be real as you get actually less than a 25. Optimally is at least above a 30, probably closer to a 50 when it comes to women. Now, men have a little bit more of a capacity for a larger level, but remember, we want to be, okay, for our ferritin, again, we'll just put ferritin for a female, right, we're going to be probably about a 30 to 150, and men, it's going to actually 3.0, right, is, again, probably more or less anywhere from like a 40 to a 250 is actually more of the range of where we're going to want to see that ferritin level in a guy. Men get anemia too, right? And the question again is, why is that happening? So again, depression, remember, dopamine, okay, is iron dependent. So if you are getting issues and you're seeing people that you know that are more isolated, harder on themselves, right? They don't want to go to places, they don't enjoy the things they like to do normally. Motivation, drive, focus and concentration issues, right? Snapping, temper. Dopamine is going to be the most common neurotransmitter that's tied to ferritin. Okay? If you guys haven't had your ferritin tested, but you're dealing with fatigue and depression and brain fog and achiness, menstrual amenorrhea, lack of menstrual cycles, right? Hair, skin, nail issues, gut-related problems, vascular issues, all those can, again, stem from anemia. Okay? So Kelly, if you're doing, so again, Kelly is right here saying she's doing 5 iron infusions a year and it still doesn't bring her levels up. That's crazy, right? That means you're missing the mechanism. Chronic infusions, and especially when you shoot your ferritin levels up exceptionally high, especially in women, when they shoot their levels above a 250, you are causing inflammation. There is something called the Ferris. There's the Ferris reaction, okay? So iron works through oxidation, meaning pro-oxidation, meaning it's an inflammatory reaction. So those people that chronically are getting this surge of iron infusions, that actually can become an inflammatory issue for you. Those people that, again, have exceptionally high levels of iron, something called hemochromatosis, which is actually relatively common. I see multiple cases a year, and people have no idea that they actually have an iron storage disease. Now, they need therapeutic phlebotomy. They might want to, avoid and abstain from some things that they're going to get actually a higher incidence of iron, because literally iron will start to deposit on organ tissue, and you will wear your system out. So my concern is, right, first of all, if we're showing low levels of iron, that even if you have heavy menstrual cycles, you still rule out gut. Okay, so let's write some of this stuff down, because if you write this stuff down, you guys will learn this stuff. That's the hard thing that I learned through grad school. You gotta write it down, otherwise it just goes in one ear and it goes out the other. Okay, so lots and lots and lots of different symptoms of anemia. But even just afternoon fatigue can be an indication that you don't have enough iron. Again, I want to ask a question to you guys. Has anyone noticed that when they were given an iron supplement, that they noticed more constipation? Has anyone had that issue? Yes, Hashimoto's can absolutely be healed. You can't cure Hashimoto's, but you can most certainly put it in remission. I've seen like a couple thousand of my clients do that. Okay, so check this out. Okay, so you guys are like this. There's a bunch of people that experience this. So yes, with the pill form of it is what I mean, right? So typically, again, they're going to recommend ferrous fumarate. Floridex is a very common example of that. But what's going to happen here, right, is that when you go to, so if you're going to get iron, an iron supplement, let's just say maybe Floridex, okay, because I think that's one that actually it's covered by insurance. You're going to, right, absorb through the small intestine. So you absorb that through the small intestine, but guess what? Iron, right, Fe plus, actually increases the production of methane-based bacteria. So if you increase methane-based bacteria, guess what you make? You make more of what we call hydrogen sulfide. Hydrogen sulfide, guess what? Decreases motility. So guess what? You get constipation and gastrointestinal issues, bloating, cramping, all of that stuff. Does anybody notice this? They got constipated when they started taking iron. Now you may have gotten actually diarrhea initially, and then it actually eventually started to flip into constipation. You guys, you have the answer for why you have anemia. Morgan is asking, what are normal iron levels? Again, I don't really look at serum iron. However, serum iron is going to usually, I think, 40 to 160 is the number on that. Okay. Now, Mama Bear, if you're getting black stools, okay, then that can be iron consumption. However, guys, remember, if you're not taking iron and you're getting black stools, that is an indication of an upper GI bleed. You need medical care. Okay? Hurdy-gurdy orchid. My rule of thumb is that when you take supplementation, you will see resolution and typically massive improvement within 4 weeks. You guys, I'm telling you this right now. If the iron was a solution to your issue, within days, you would have been like, oh my God, I can't believe how amazing I feel. But yet, very commonly, people will get diagnosed with anemia, right? They're given an iron supplement, which is absorbed through the small intestine, which is where the problem is. So the iron that you're trying to absorb in your small intestine actually increases the production of methane-based bacteria, which produces hydrogen sulfide, which impairs motility, and it gives you constipation. Super duper fun. Thanks, Doc. Really appreciate it. And the reality is that the number one root cause, okay, of anemia, drum roll, brrr, can we get a drum roll? Brrr, is SIBO. SIBO. Libby, dysbiosis. Morgan Ray, gut health. Woohoo! Right? Low mean cell height, low mean cell volume, low mean cell height cell. K. Sammy, that's microcytic hyperchromic anemia. That's an iron deficiency anemia. Okay? Jep, I'm a chiropractor. Oh my God. I've been doing functional medicine for 15 years. I can almost guarantee you, I can look at your labs and I will give you way more information than your medical doctors will. Why? You know what's great about what I do is that I don't use pharmaceuticals. I don't use medicine. I don't like medicine. I don't like drugs. I don't like what they do to people. And I don't like the fact that you're putting a Band-Aid on an issue that should be probably handled through your diet, through specific supplementation, and something that's not even going to be close to touch typically in an insurance model. Because again, if you don't have an ulcer, or if you don't have a polyp, or if you don't have a bleed somewhere, your doctor is literally just going to throw iron at you, okay? And then if that doesn't work, they're kind of like, I don't know what to do. But meanwhile, as you're getting worse, right, you're going to have to get an infusion. And of course, that's covered by insurance. But a lot of people feel terrible after they get infusions. And again, you're not realizing that you're spiking your iron levels high, which is an inflammatory issue. Again, that's the Ferris reaction. You can feel worse, right? And then what happens is you're left going, well, I guess I just have to take iron the rest of my life. And that's not okay. So Emma Steam, how do you cure SIBO, right? Because that is the number one thing. This is, and so here's the deal. SIBO is a form of dysbiosis. So it's kind of like dysbiosis, which just means an abnormal relationship between the host and microbes. So that's at the largest kind of like non-specific categorization of abnormal bacterial relationships, right? It's called dysbiosis. So there's different kinds of dysbiosis, right? So again, like I said, you can have methane-based SIBO, you can have hydrogen, right, H2 based SIBO, and those are more based on testing through lactulose testing. So you actually take a sugar and you consume that, and they measure those gases. For me, I'm always going to recommend doing a PCR stool test. I use something called the GI map, and that will tell me what's more explicitly what actually is growing. Now, again, a very, very important cause. Someone said, hey, how do we fix SIBO? Look, here's the deal. You're not going to fix SIBO just by taking antimicrobials. You're not going to fix SIBO just by taking an undecanoic acid or oregano or Artemisia annum or black walnut. There's all these amazing natural antimicrobials, and I do use them. However, again, one of the most common, so let's just go and look at what are all the different mechanisms behind SIBO. If SIBO is the number one cause, now remember, number two cause of anemia, ladies, is excess and heavy menstruation. But what happens is that too commonly, doctors are trained, this is what I've been seeing for the past 15 years. Women are brushed off and told you have a heavy menstrual cycle, and so you just have a heavy menstrual cycle, so we're going to give you hormones, right? We're going to put you on birth control because your menstrual cycle is just too heavy. And you're like, why? Well, just because some women just have those issues, and that is bullshit. That is probably inadvertent gaslighting because you just don't have heavy menstrual cycles. You have heavy menstrual cycles because you have a dysregulated menstrual rhythm. And there may be fibroids causing that. You may have insulin resistance causing heavy menstrual cycles and therefore heavy menstrual bleeding. You may have toxicity of chemicals stimulating estrogen molecules. You may have inability to detoxify because your methylation is poor. Yada, yada, yada. There's mechanisms, there's reasons why. Do not let a doctor tell you, oh, well, you just have heavy menstrual cycles. Like, no, I'm sorry, you missed that lecture where there's actually reasons why women have heavy menstrual cycles, and you missed that lecture. And so now you're gaslighting clients, right? You could have endometriosis, absolutely. Endometriosis is autoimmune, by the way. Okay, a lot of people don't understand that. Doctors don't even know that endometriosis is autoimmune. Yes, Mama Bear, this is wow stuff. This is a wow lecture. If this is not helping people to go like, wait a second, are you serious? You're telling me my gut health, or you're telling me my blood sugar health, environmental health, are all things that are influencing my menstrual cycle and therefore my iron level? And that could be the reason why I have chronic fatigue and I'm depressed and I have no motivation and life sucks. And yet I just take this iron pill and it's going to make magically everything go away. That's not going to happen. It won't, right? So again, let's talk about the different mechanisms, again, that's causing the number one reason behind SIBO. There are other root causes, but I want you guys to understand some of the big things that I've been seeing over the past 15 years, because ultimately when you start to realize, oh, I do have that issue, or oh, wow, I have that problem, and you solve it, you are going to manifest the best version of yourself. Which is what we're supposed to do as providers. We're supposed to help people heal themselves because your body heals itself. But not if you have these stumbling blocks, right? That you keep stumbling over and over and over. So when we start, again, looking at a problem in a different manner, in a different way, we start making the box bigger so you can actually fit inside the box, you're going to start changing your life. Because it's not just about, again, eating T-bone steaks that's going to fix an anemia. Yes, if you're vegan. Yes, if you're vegetarian, you're going to become anemic because you have, again, there's two forms of iron, right? We have heme iron and we have non-heme iron. Again, guys, trust me, that I have a master's in nutrition. This subject I just have studied and gone through, and I've seen over 5,000 patients clinically in 15 years. And the people that are becoming anemic, one of the reasons is because they're eating the wrong source of iron. Non-heme iron, spinach, molasses, these things that people tout, right? Oh, the high source of iron. I'm like, well, yeah, but they have lignans and phytic acid, and the fact is it's the wrong form of iron. Heme-based iron, animal-sourced iron, is the absorbable form. Again, I didn't make up the rules. I learned the rules, and I want to help people understand what the rules are so you guys can manifest, again, the best version of yourself, right? Someone just mentioned sleep apnea. Sleep apnea can actually push your ferritin levels high. So that's an actual, that right there, if your sleep level, if your ferritin is high and your C-reactive protein is not high, okay? Meaning, because if your ferritin is high and your CRP is high, then ferritin is basically acting as an inflammatory marker. If your ferritin is high and you don't have elevated CRP, the first thing I'm thinking about is sleep apnea. Second thing I'm thinking about is that you're terribly insulin resistant probably, and that's actually causing the sleep apnea in the first place, because that's the number one mechanism and the reason why people develop sleep apnea is they are fat deposits, right, on their actual folds, right, like that tissue right over the trachea that's basically allowing that airflow. So if you have a fatty epiglottis tissue, an epiglottal fold, you're not going to get actual positive pressure into your lungs, and therefore you're not getting oxygen to your brain. Okay, so anyways, that's a little bit of a sidetrack on that, but let's talk, again, let's go into where, because again, I got 34 minutes with you guys. I want this to be the best impact as much as I can. I want you guys to leave this lecture and feel like, damn, he gave me a bunch of information that I really need to speak to my doctor about. And if your doctor can't do this, you guys need to call my office. You guys need to grab a discovery call. You guys need to get the labs that we give our clients. Sit down with me, and I will show you how. That's it. That's my job. That's what I've been doing for the past 15 years, is showing you guys what are the actual root causes and giving you a plan. Like I said earlier, if someone's anemic and we're fixing their root causes easily within 30 days, they should feel dramatically better. Dramatically. Like, my depression's gone. Oh my God, I don't have anxiety anymore. Oh my God, like, I've got energy. I want to go exercise again. Oh my gosh, I want to go out and hang out with my friends again. Like, life. But it doesn't happen because you'll feel cold, you'll feel brain foggy, right? You'll feel fatigued. A lot of people have joint pain. They have all these symptoms. They don't want to go out and live life. So if your provider's not doing that for you, find a functional medicine provider that will kick you in the ass and show you exactly what you need to do, because that's what we need sometimes. We need someone to kick us in the ass and say, hey man, clean up your diet. Hey man, look, it's your environment. Hey, look, you need this supplementation. Brittany, high ferritin is inflammatory, okay? So you got to figure out why you have high ferritin. You know what I'm saying? Man, I'm just, I watch lives, I see doctors, and I'm like, you're boring. Teach these people. Inspire these people. I'm sick of it. Fuck, man. Someone get up there and do something. So, NS Wars, paleo, I like paleo. Yeah, I think it's great. I think it's good. Again, I think people will hear me talk about, vegans and vegetarians, and I rag on them. But I'm not really. What I'm saying is that I think actually people need vegetable matter in their diet. I think people need a lot of vegetable matter in their diet. And the vast majority of the people that I work with and Americans do not hit even remotely close to the minimum of fruits and vegetable content. But you have to have iron, and again, that's going to come from animal sources. So whether it's from beef liver or you're going to get it from animal protein, red meat's going to be the best source of it. And what you're being told about red meat is completely false as it relates to sustainable agriculture. So if you guys want to help the environment and you want a nutrient-dense food, you need to eat 100% grass-fed protein. And that's going to be your venison, that's going to be your deer, elk, or again, your sustainably raised cow. Okay? Kelly, Kel, if you got alpha-gal, man, reach out to us. We can help you with that so much. I got a guy right now, Kelly, and he's had alpha-gal. He had mold issues. He had mercury levels, excess mercury levels. And so again, he got over his tick exposure, but he developed autoimmunity, celiac disease, and other autoimmune conditions outside of the alpha-gal syndrome. So again, if you guys don't know what alpha-gal is, it's related to the Lone Star tick. People get bit by this tick, and they actually react to mammalian products. Well, now guess what? For 5 weeks, he's been eating mammalian products, no reaction whatsoever. So it wasn't so much the alpha-gal syndrome, it's the fact that his immune system was really pissed off because he lost control of his immune system, right? So again, SIBO, S-I-B-O, right? Again, number one for what drives iron-based anemia. Iron-based, remember guys, there's macrocytic-based anemias. Those are when your mean cell volume actually increases in size. If you guys have had a white blood cell, right, with red blood cells, and if your doctor glossed over the fact that you have a high mean cell volume, the higher that's over 93, the more that correlates to a B12 deficiency. Do not let your doctor gloss over that. Hey doc, I heard that if I have a high mean cell volume, that could mean that I have a B12 deficiency. Oh, your B12 level was normal. Oh, but wait a second, I also heard that your B12 level is not really reflecting what's inside the cell. Well, you're right. Intracellular, you would have to test something called methylmalonic acid. Okay? MMA is the most accurate test, and even sometimes that comes back normal, but you will still respond to B12 supplementation. Okay? Ooh, Jeannie, what do you think? Carnivore diet for a year and you have MS. I'm curious to see how that's working out for you. So guys, I did carnivore diet for 2 weeks and I hated it. Died. I was like dying. I mean, it was bad. I got a cold too, but I think my immune system was stressed. And so the thing is that I've been exposed to a lot of antibiotics, guys. So I developed, right, for me, I developed fungal intestinal bacterial overgrowth, and that started my celiac disease. So, but the big thing for me is that because I've had many rounds of antibiotics, okay, I have issues maintaining healthy populations of beneficial flora. So for me, right, you can have what we call insufficiency dysbiosis, which basically means low Bifidobacter acidophilus, right? So those are you just don't have enough beneficial bacteria. And again, antibiotics, okay, proton pump inhibitors and steroids all lead to insufficiency. So again, someone was saying, how do you fix SIBO? Well, first of all, if you're taking antibiotics or proton pump inhibitors or steroids, forget it. You're not going to get that beneficial bacteria to actually regrow in the system. Yes, leaky gut. So someone right there said, hey, what about leaky gut? Well, guess what? Leaky gut is literally producing inflammation. Inflammation worsens SIBO. So if you have leaky gut, that actually will also make SIBO worse. But remember, this is a two-way street. SIBO will drive leaky gut will come back and drive SIBO. Parasites, yes. So again, other infectious issues are absolutely relevant here and things that need to be addressed, right? So yeah, someone just said candida. Again, that's what I had, was a fungal issue, right? Nadia, what is leaky gut? So essentially, leaky gut is when you have everyone has a barrier in their gut. We all have actually barriers on all of our mucosal systems, whether that's your skin, your lung, upper respiratory tract, genitourinary tract, but in particular your gut, which is where we have 70% of your immune system. You have a single cell layer, right, of cells. On top of those cells, you've got a shag carpet and you've got mucus on top of that. So what happens is, again, stress, physical trauma, infectious issues, inflammation, lack of nutrients, mechanisms, okay, lack of digestive enzymes, right? That barrier physically actually is broken down, meaning cells start to die off, in between cells start to loosen, and now all of a sudden you have big gaps in between those cells. That allows permeability. So stuff inside your gut gets through into your systemic circulation. Leaky gut is the mechanism behind autoimmunity. I don't care if it's MS or rheumatoid arthritis or Hashimoto's or lupus, leaky gut drives autoimmunity. The more important thing is it why do you have leaky gut? Okay. It's not just about taking the supplements here. Yes, supplements are definitely helpful, and I use them all the time. But are you leveraging them to what your specific issues are? If you have insufficiency dysbiosis, meaning you have low levels of beneficial bacteria, again, your bacteria in your gut are that's helping you absorb your nutrients. So J398, yes, leaky gut can be reversed. It takes about, again, 2 to 3 months to actually reverse that. If you guys want more information on that, guess what? I just created a leaky gut handout because I'm talking and lecturing on leaky gut all the time. And I get questions all the time about leaky gut. So I'm like, okay, I'm over it. We've got 2 handouts you guys can get from our bio. One of them is a 3-day diet guide, and one of them is our leaky gut handout. Okay? And that will go more into depth and detail on how you correct that. Okay, so, and again, if you guys want help with that, that's what we do. This is my passion. This is what I've been doing for 15 years, is helping you understand the root causes and the mechanisms, and that comes through our new patient evaluation. Okay, so here, stress. For sure, stress is going to drive SIBO. Why? Because, again, cortisol, guess what? Inhibits your beneficial bacteria. Artsy crafts, yes. I've helped many people with lupus get into remission. But it's a serious condition, so you have to be really serious about actually addressing that. So, you guys, the reality is we're always going to have stress. It's about what's going on, what's causing that stress, how do we mitigate that stress, right? Again, even today, I was going over a stool test. I was going over a GI map today, right? And she had low levels of beneficial bacteria. She had an overgrowth of H. pylori and strep. So I said, look, we're going to use prebiotics, right? We're going to use probiotics, actually, to go after both the dysbiosis issues that are there. But then when I looked at her Dutch test, her adrenal test, she had very high levels of cortisone. So what that tells me is that, again, when you have inflammation that's chronic, it was dragging her energy down in the afternoons. So guess what? Jay, what's up? Signed up for the newsletter. Good. So if you want the handouts, though, you got to specifically sign up for those handouts, and then we'll send those to you, okay? But again, what I'm trying to say here is that in the afternoon, this woman, right, because her energy was tanking. Anybody's energy tanks in the afternoon? So guess what, right? Gut problem, her adrenals were dragged down, and so what is she craving in the afternoon? Starbies, baby. She goes to Starbucks every day. Sugar and caffeine. And what do you think dietarily contributes to SIBO? Refined carbohydrates. Now, let's talk about FODMAPs because we're on the topic, okay? There you go, Tinkerbell, the devil. Sugar. Again, people will be like, well, what about honey? It's fructose. What about coconut sugar? It's going to break down to sugar. What about potatoes? Sugar. What about rice? Sugar. Okay? So reflect you is saying, well, what about an apple? So guys, there's a list of foods. Okay? Yes. Are you doing 75 hard, Ash? This is saying 75 days of no sugar. That's awesome. Yeah, mushroom coffee, that stuff's good as long as it doesn't have sweeteners. Remember, stevia, lohan guo, which is monk fruit, those are fine. They're not going to impact your blood sugar, right? Nice, Ash. Get it. 75 hard. Proud of you, man. I just added cold baths. So I'm doing a cold bath in the morning when I woke up. Man, I feel awesome doing that, guys. And I'm like, I wanted to buy like the cold plunge thing, and I'm like, whatever, I got a bathtub. Like, I'm just gonna fill it up with cold water. I live in the mountains. Dude, my water is so cold. It is, and I'm at 3.5 minutes right now, and it is so painful, but it's amazing. Agave is not okay. Again, agave is refined sugar. Okay? Debbie, thank you. So again, right? So we've got this thing called FODMAP. Fructo-oligo-disaccharide monoamine polyols. So again, if you've been diagnosed with SIBO, your doctor has probably said you need to go on a low FODMAP diet. And then the question would be, well, how long? And they may not know the answer to that, but many of them will say the rest of your life. And you're like, wait, I gotta avoid onions, and I have to avoid garlic, and I have to avoid asparagus, and I have to avoid apples, right? Like all these foods, guess what? Wheat, fructans, wheat. You guys, wheat is one of the worst foods for SIBO. Bananas, good question. So what I tell my clients is berries are kind of where you're at. Apples have a moderate level of again, the FODMAPs in there. SIBO is small intestinal bacterial overgrowth. So it's not that, no, onions and garlic, again, are good for you. The problem is, again, the reason why FODMAPs are at issue is that these are the foods that contain long-chain polysaccharides. So what happens is that, again, because of this bacterial overgrowth, and very commonly because consequently of other factors going on in your body, hormonal, environmental, leaky gut, etc., your body starts to lose the ability to break these long-chain carbohydrates down into smaller pieces where you can physically break them down enough to absorb them. So what happens? If these don't get broken down, they get further and further down your gut, so you ferment. And so what does that feel like? Well, that's gas, and that's bloating. Oh, and then before you know it, your ferritin level is low, and you're brain fogged, and you're fatigued all the time. Does this sound familiar to anybody? And then you start having menstrual irregularities, and your doctor's like, well, your menstrual cycles are irregular. We're going to put you on birth control. You're like, wait, more hormones? More hormones to fix the hormone problem. I don't know about that. Right? So what I want to say is that, look, short term, I do not do FODMAPs more than a couple months long. I'm not going to put someone on a FODMAP diet unless I've also done a stool test. Here's the deal, guys. Probably the number one issue, right? One of those huge issues that it actually relates to FODMAPs, okay, is an enzyme called elastase. This is a pancreatic, okay, carbohydrate enzyme. Have you guys had your elastase tested? The vast majority of you guys are going to say no right now because doctors don't test this. Gastroenterologists don't test this. Oh, Debbie. Debbie, you have. Right? It's called elastase. You can check this in blood. I prefer that to be in stool. Elastase is the test of your pancreas' ability to essentially create the enzyme that breaks carbohydrates down. Woo! 40 pounds in 2 months? Debbie! Wow. Okay? So, again, the elastase right here, there's different reasons that can, again, turn that off. Part of it is SIBO. Okay, so again, this will go back and forth with bacterial overgrowth as well. Another very common mechanism that drives this is insulin resistance. So again, if we have blood sugar related problems, that can also turn off the pancreas as it relates to that carbohydrate digestive enzyme. So if you're fatiguing after meals, if you're craving sugars after meals, this is the most reflective symptom of insulin resistance. Stephanie, you should not have to get iron infusions often. We need to figure out why you're having low levels of iron. Okay? Nadia, if you're insulin resistant, man, again, the number one recommendation I can give you guys is one of these devices right here. It is a continuous glucose monitor. This is a CGM. This will tell you exactly what your blood sugar is doing in relation to what you're eating. So again, on top of that, most people have no idea what their blood sugar is doing, no idea how it's impacting their health. How could your blood sugar even be remotely related to iron deficiency? Well, guess what? If you had a high diet of refined and non-complex carbohydrates, refined, right, and deplete carbohydrates, you're going to feed negative bacterial overgrowth in the gut, and you cannot absorb your iron if you have SIBO. So again, gas and bloating following meals is not a normal symptom. It may be average, but it is not normal. And I was just talking about this the other day, right, with my family. You should not be fatigued, nor should you be relieved and energized after you eat. Your blood sugar should be stable. Just eat lunch, go back to your day. Now, if you want to help control your blood sugar, you might want to go for a walk after you eat your lunch. But again, most of the time, people's fatigue levels dramatically increase right after lunchtime, which would be another indication that they have an adrenal issue. Okay? Yeah, Charlie, you got it. Food is either, right, the culprit or the cure. A whole torso full of air regularly. Yeah, for sure, Jay. I mean, it's going to happen. Angela Dean is saying, hey, man, it's so interconnected. I don't know where to start. You guys, this, I know. So here's the thing. There is this phenomenon called paralysis by analysis. It's that there's too much data. We don't know where to start. I don't know what to do. Here's the deal. You got to start somewhere. Blood test is going to be the most effective way to look at the majority of the systems that you have. Okay? That's why I start with the blood test. Paperwork, if it's done correctly, and you're looking at systems physiology, is a great way to start to look at your systems and start to say, seems like the gut might be an issue. Seems like, yep, brain, that might be involved. Seems like your immune system is engaged here. So as you start to look at the different systems and you compare that to blood work, you start to understand, oh, there's an overlap, and that should start to explain your symptoms. I tell this to my clients all the time. This should not be science rockets. This is literally understanding that there's going to be a mechanism that's pushing on your physiology, and as you fix your physiology rather than focusing on your symptoms, so shall you improve. So shall your symptoms lessen, and so shall your labs improve as well. Because your symptoms and your labs should actually start to get better if you're truly healing. So it is all interconnected, but it's taking, and again, for me, look, I'm biased. I'm biased through functional medicine because I've seen it heal and I've seen it change people's lives every single day. Every single day I'm blessed to work with people who want to get better. I think that's the most direct and the most logical solution is to find someone experienced in functional medicine and hire them to teach you what to do. because they should be teaching you. They shouldn't just be teaching you to take supplements. They should be teaching you about what are the aspects of, again, the chronic issue. How do we correct that? What do we need? What are we doing for labs to repeat to show you that what you're doing is working? So don't get too bummed out about that. But I mean, literally what I was just saying before is, look, if you guys are a vegan, if you're a vegetarian, look, I understand that you're making a choice, but is that what your body needs? You know, what's going on with like your social choices versus what your biochemistry has been designed to need may be radically different. If your doctors said, hey, there's nothing we can do for you, well, you're going to have to start doing something different. If you've taken iron and you've gotten worse, that is screaming small intestinal bacterial overgrowth. Again, the crazy thing is some people, right, won't even have a positive breath test. But if you do a stool test on them, you will see the dysbiosis. It will be there, right? Because again, like I was saying, one of the things that actually drives SIBO and dysbiosis is not enough beneficial bacteria. How many people out here have, again, taken antibiotics? It's a big problem. It's a huge problem. So sometimes, again, it's avoiding those things that are driving it. Sometimes it's feeding that beneficial bacteria in the gut through fiber. Again, vegetables, protein, and fruit. Vegetables, protein, fruit. Sometimes it's protein, fruit, and vegetables. Okay. Jesper, what was the question? Sarah, 2 ways there's 3 ways you can actually test for SIBO. Stool test, breath test, Sarah, and then also just from your symptoms. So again, gas and bloating typically following meals, especially with carbohydrates. Parasites, yes, parasites are relevant here for sure. And so again, parasites do get involved. I don't see that nearly as much as bacterial issues. Gut health is very much related to chronic hives. Absolutely. Itzel Gerardo is saying, hey, any advice for acne? Guys, the number one thing that causes acne in this country is polycystic ovarian syndrome. We have an epidemic of PCOS in this country, and the number one thing, again, the issue behind PCOS is an enzyme called 5-alpha reductase. That's the enzyme that gets pushed up typically because of insulin resistance. So if you want to fix your acne, you got to stabilize your blood sugar first and foremost. Now, vitamin A, zinc, GLA, EPA, DHA, right? Oleic acid, there's fatty acids. Gut health very much influences acne, but again, the majority of acne tends to actually be blood sugar. Same thing, acne for men, absolutely. So Sarah, again, the endometriosis, right, is also connected to the acne, right? The acne is related to the endometriosis. Drea, yeah, POTS is definitely related to your mitochondria. It's not just misfiring, your mitochondria is disorganized. But again, 90% of the time, people with dysautonomia, they come back with positive autoantibodies, and typically against structures in their brainstem. So there's called acetylcholine receptor antibodies, and those are, again, found in 90% of cases of POTS. And I'm getting tired, so I've been standing all morning talking to clients. So I'm going to take a seat. So guys, we started this by saying, if you've had a diagnosis of anemia, or even if you suspect it, right, with the symptoms of anemia, then obviously you need lab tests. Or if you've had lab tests and you've been told, oh, take iron, but you feel worse, it's like, well, what's next, right? If you're less than a 30, you're probably going to feel symptoms as far as your ferritin levels go. That's for women. If you're above a 150 for ferritin, that is also an indication of an acute phase reactant, which is inflammation. Okay? So outside of that, we have to asking, why do we have, again, low iron? It's not just, oh, I'm not eating enough. It could be, again, for the extreme side of this, for those vegans and vegetarians, yes, you're probably anemic because you're not consuming enough. But the number one mechanism is, again, related to absorption because of gut health. Now, you may have heavy menstrual cycles, but heavy menstrual cycles associated with estrogen dominance is also most commonly provoked because of insulin resistance. I also mentioned that insulin resistance is, again, the mechanism that's going to cause you to have deficiencies in elastase. And that is how you break carbs down. So if you don't break carbs down, you ferment carbs, and it's going to cause gas and bloating. Again, if you had a diagnosis of IBS, guess what? When you have a diagnosis of IBS, your chance of developing iron deficiency anemia is statistically higher. Okay? Life Mongoose, best way to improve gut health would be to avoid crap in your diet. Balance your stress, get adequate exercise, and make sure you have good sleep hygiene. Eat protein, vegetables, and fruit, and utilize probiotics and prebiotics. There it is. Vegan during the week, but some eggs during the weekend. Can you still get iron? Nah, there's not a lot of iron in eggs, my dear. It's definitely better than nothing. So let me just acknowledge that. If you're kind of like mostly vegan, but you're getting some eggs, you're getting some really high quality protein. You're getting really good fat with that. Again, most vegan diets are really terrible as far as the fat because you're not getting DHA on a vegan-based diet and most vegetarian diets, unless again you're also consuming egg products. Ferritin of 11, Ghetto Princess 94. That's too low. Too low. You're gonna be fatigued all the time, and you're cold. And you're gonna be depressed. It's not fun. Dopamine comes from iron physiology. Jamie Wythe, how do you know what strains of probiotics you need? Well, either you do the research and you look at what physical strains you need. Guess what? The manufacturer of probiotics, they don't show you what strain they have in their product unless you directly ask them. So you're going to have to do some digging. Now again, if you know what strains you need to use, that's your way of knowing which probiotic to use. So there is some marketing here, but there's some truth, and sometimes like the urinary tract formula or an IBS formula, there may be some research behind those strains, but it's all about buyer beware. Again, most of the time, my number one probiotic that I sell in our shop and that I recommend to my clients is called GIT Power, G-I-T Power. That's in our supplement shop, okay? That's a Saccharomyces boulardii. Saccharomyces boulardii has been shown to do two major things. It ejects the bad guys in the gut, and it builds up the mucosal barrier in the gut. So probiotics do a lot of different things. Prebiotics are a little bit easier to use because prebiotics, they bring up all the beneficial bacteria in the gut. That's a product that I use called Prebio Power. So that's it's modified guar gum is what that is. Thank you, Leo. Yeah, when iron pills don't work, Beth, you got to find out what's really going on here, because iron infusions is not fixing the root cause. Iron infusions will temporarily increase your inflammation. Yes, they'll increase your ferritin levels at the expense of significantly jacking your iron levels up. Lots of side effects associated with that, and it's not a long-term strategy. The number one reason, again, that people that develop iron deficiency anemia is because of malabsorption. Now you just got to figure out what's causing the malabsorption. Again, for most people, it's dysbiosis. How do you fix dysbiosis? Do a stool test, okay? Some people have dysbiosis because, again, they're eating grains, and their body's not suited nor adapted to consuming grains. You may have gluten sensitivity. Guess what? Gluten, when it's not broken down, it gets further down the GI tract. It ferments. You get gas and bloating from it. Not only that, typically you're just gonna feel terrible. And then your doctor's like, well, you don't have celiac disease, so I guess you can eat wheat. And that is false. There are other mechanisms outside celiac disease that are relevant as it relates to your gut health, to your metabolic health. So again, you need to do better testing and figure out what's going on here, or again, change your diet dramatically from what you've been doing. Duck Trash says, why did I get hypothyroidism after going vegan? I mean, man, from lack of amino acids, lack of nutrients and minerals, it's a stress on your body, Duck Trash, to go vegan. You can't get the right, here's the thing. The number one, guys, The number one nutritional deficiency that I see in my practice, what do you guys think that is? What is the number one nutritional deficiency that I see? And I would say outside of vitamin D, okay? Outside of vitamin D, what is, and that's a hormone anyways, but what is the number one nutritional deficiency that I see? Sarah, it's not iron. Magnesium is up there, but that's not the answer. Nope. Duck trash. Boom. Nailed it. Yes, it's protein. It's amino acids. You guys, the amount of amino acid deficiency that I see on lab testing is at an epidemic. It's crazy. It's amino acids. Basics. The basics. So, you guys, you know, I get it. There's like, it's always sexy, and you know, when you look at the fancy new things that are coming out and the red light therapy and all this stuff and high pH water, don't get me started on that. The fancier and the more outlandish this stuff is, the less likely that it's really relevant to you. You guys, when we are made, right, we're basically the Model T. What I mean is that people think that we're Ferraris and Mustangs, right? Because this is the 2024 version. You guys, when 50,000 years ago, when our ancestors were eating our ancestral diet, right, and that the Model T was coming out, it's the exact same damn thing as it is today. There's not radical differences in our genetics 50,000 years ago as there is today. So if you're not eating similar to what they were eating, there's a very good chance that is making a major impact in the quality of your life. We are the clay. Kristen, what lab test do you need to get tested for autoimmunity? It really relates specifically to the tissue that's having autoimmunity. Again, just so happens that the number one, right, the number one autoimmune condition in the United States is Hashimoto's. So if you want to rule out Hashimoto's, anti-TPO, that's thioperoxidase, anti-thyroglobulin, and that's a transport protein. But those are the two antibodies associated with Hashimoto's, right? Love like crazy. So does our blood test for the MTHFR gene? That's not the first test that we do, love like crazy. Yes, 40 to 45% of the population has at least one genetic defect in MTHFR. If you guys don't know what that is, that's a methylation gene. That's important. It relates to activation of B vitamins, and a lot of people lack that enzyme, okay? Naomi, yes. But again, back to the MTHFR thing, I don't screen that on everyone right off the bat because, again, blood work, like everything else, is expensive. So I always get the most predominant markers that I'm concerned about. Now, the second round, I will recommend additional lab tests, and sometimes I do recommend MTHFR testing. No, it's not a choline deficiency. Choline can be used in the reduction of homocysteine, Michelle. So you can use choline therapy to actually help you control homocysteine. But MTHFR is a gene defect. It's called a SNP. Okay, it's not a choline deficiency. Is Graves' disease autoimmune? Beth, yes. Christine Barra, strange sounds in your ear. My curiosity would be, have you had COVID recently? Nexium, proton pump inhibitors. My God, please stay away. Shay there, can you list tests we should do regularly if we already have autoimmune? Psoriasis, again, dermal dysbiosis, abnormal relationship of beneficial and non-beneficial bacteria on your dermis, on your skin, but also very commonly associated with lipopolysaccharides or gram-negative bacteria found in your gut. So what tests you should do? The tests that you need to figure out what your root causes are. And that's going to be different for everybody, Shay. So again, it's really hard to tell you what those are, but again, everyone needs to have a really good comprehensive blood panel. And I cover that on my initial blood panel that I do with clients. We do 90 markers on everyone, and I do a 90-minute consult. And then from there, I'll say, hey, look, we need a stool test, or let's do a wheat test, or let's look at your hormones more in general. Maybe we want to do a Dutch test, or, you know, hey, do you need a glucose monitor because you have a blood sugar problem? Then we start to individualize, because I don't throw everything at everyone anymore. I don't need to. The more you do this, the more you realize that there's probably 2 to 3 major issues going on with people. You just focus on those. And then people go, whoa, I'm feeling so much better. I'm like, there you go. Those are your issues. Keep that lifestyle going because you have to keep that lifestyle going. If you go back to the chocolate cake lifestyle, you will get a chocolate cake outcome. Usually not that great, even though it tastes good. So do I use local labs and are they sent to you? So Glam Ma Gems. So we send you a drop ship of a test kit. And that's if you're in the United States. Okay, so that comes to your door and then you schedule with a company called Vibrant. So we use Vibrant Labs. You'll get a phlebotomy. That's typically, unless you're very rural, okay, that's typically covered in the cost of the $350 new patient exam. Do normal GPs do stool samples? Nope. Nor do they know how to analyze them. Most gastroenterologists don't do stool testing, which is insane. Does gut cleansing cure the gut? Exteriors? No. I'm not a big fan of gut cleanses. It is adopting a different lifestyle, and it's fixing the reasons why your gut has issues. Okay. So again, Samantha Rose, we do work with people in Canada. Just understand that your government does everything that they can to try to slow down and disrupt the process of us getting information back from you. And so again, if you're international, you want more information on how we work with international clients, it's info@drautoimmune.com. And so that's a proton pump inhibitor. Exteriors, okay? It's called the purple pill. The purple pill, and so I call it Purple Poison Incorporated, okay? But it's a proton pump inhibitor. The ancient diet I mentioned, just paleo. And again, paleo has a lot of different meanings to it. I guess I'd kind of more lean towards Mediterranean because then again, we're talking fresh food, high amounts of olive oil, dominance of protein. I do not recommend grains whatsoever. Leafy green vegetables, cruciferous vegetables, in season as much as possible, organic preferably, right? Jan Hoover, yes. Mast cell disease is not a disease, it's a syndrome. Okay? Okay, so you guys, again, we have a leaky gut handout we just developed. We got a 3-day handout. They're both in our bio. They're in my link tree. Okay? Ashley Lynn, if you want stuff on leaky gut, you need to go grab my leaky gut handout. Okay? Sierra Nana, yes. So the prebiotic that we carry, which is called, again, Prebio Power. The probiotic that we use is called Immunopower. That has some other stuff in there too. It's like an anti-inflammatory, but it's also a probiotic. But people don't understand that like probiotics actually are anti-inflammatory. So Prebio Power is the prebiotic that I recommend for clients. Just remember, guys, 1/4 scoop to start with at most. Don't start with a full scoop of any prebiotic whatsoever. All right? Manda, no, we will require our blood work as well. You can load your blood work up to the portal. I know it's annoying, but I'm gonna be annoying because I wanna make sure I have all the right information for you. But yes, you can load that up to the portal. We're still gonna require that you get our blood work because I do not want to leave stones unturned. I need to know what's going on and I need to be confident. So before I accept anyone for care, I must have internal confidence that I'm going to change your life. Otherwise, I don't really want to take cases on because I don't want drama. I want people to get results. That's how I roll. Okay? All right. So guys, again, Dr. Ian here, Dr. Autoimmune. It has been lovely. It has been fun. We were talking about iron deficiency anemia. Hopefully you got that. If you guys didn't get that and you want to hear a lecture on iron deficiency anemia, I'm gonna go ahead and load this onto YouTube. So you just need to email info@drautoimmune.com if you wanna hear the whole lecture and you missed it, you came in late, again, we'll load it up to YouTube and you guys can actually then watch it at your convenience. But again, info@drautoimmune.com. Lucy, thank you, appreciate that. Hey, thank you guys. Just, you know what? Thank you guys for tuning in. I really appreciate everybody that's here. TikTok, again, you know, say what you want about TikTok, guys, but there's a reason why we're here. It's an amazing community. I can actually speak my truth. I haven't really been silenced, even though there's lots of people that want to silence me. But the reality is that I'm not a whore to any pharmaceutical industry. I'm not a whore to insurance. I don't care what other people think about me. I have way too much of an exterior for people's words to cause problems with me. My job is to, again, ignite and excite you guys back to the realization that maybe you can heal yourself. Maybe there's something different than what you can do and what you have been doing. And when you guys start to get that spark, you know what we call that? That's vitamin H. Vitamin H is hope. There is so much hope for you guys. You have no idea. Because every time I get to see a new client and I get to see those things that are so obvious to me, but they're maybe not so obvious to you, and I get to teach you in that moment, I feel like I'm doing what I was called to do by God, is to help people understand that they have real reasons why. And we just have to point those out. So until next time, again, this is Dr. Ian, Dr. Autoimmune. Let your health soar.